All right, good afternoon. Welcome. I am your truly Dr. Barry Pierre, your host of Medicine Mondays, Lunch and Learn with Dr. Barry podcast. And today we are bringing you our first ever Lunch and Learn Community State of the Union Health Address, right? And what better time to do it, right? Especially with an administration change that is on the horizon and a lot of things happening that won't allow us to say that politics and healthcare are parallel roads that we don't have to worry about. No, we're about to run into each other. And this is something I wanted to do for the Lunch and Learn community because my big thing is empower yourself for better health, right? And what better way to do it than to kind of get you guys prepared on what to do for at least 2025 and moving forward. And this is actually something that, this state of the health address that I plan on doing every year around this time frame. Again, it's just a perfect time to kind of bring it up, especially with this new administration that is coming in. So today, we're going to be talking about specifically three important people who are in the administration or potentially going to be in the administration running positions that will directly affect how me and you take care of each other or get taken care of. And that is Robert F. Kennedy, Dr. Oz, and Linda McMahon. They have been appointed to positions that I think are, all of the positions that the president appoints are important and have some effect on healthcare. But I think these three are definitely important. Linda McMahon, we're going to have to tie in a little bit because it's one of those things where because she's going to be, I guess, our Secretary of Education. And you're all right, how does that affect healthcare? We're going to talk about that later today. So it is important for us to but I think that's going to be our big driver today on this State of the Health Address is figuring out okay, the people who are in charge, how can they affect how the doctor-patient relationship goes? How can they affect my healthcare, my health insurance, my co-pays, all of those things, under the sun? How can these three people affect it? And then you're going to hear why I'm not a big fan, right? If you've been following me long enough, you'll know why I'm not a big fan, at least one of them. But you'll hear why there's some concerns with the other two as well. So stay tuned for a great, amazing State of the Health Address with yours truly, Dr. Barry Pierre. All right, so I first want to start out with Robert F. Kennedy Jr. He is going to be the head or potentially head of Health and Human Services, right? And I want to, first of all, kind of give us a foundation because I think especially one of the things I like to do in my Lunch and Learn community, if I give the foundation of why I think something is important, it'll be much easier for you to grasp and understand why something else is important, right? So let's talk about what is the Health and Human Services and what do they do, right? So again, I shout out to Perplexity. The Secretary of Health and Human Services is one of the most important roles in federal government when it comes to healthcare. I think we should stop right there. We could probably stop right there. I probably don't have to explain all of the departments that they're in top of, but we could probably start, but we'll keep going. The Secretary oversees programs, agencies that impact every aspect of public health. Y'all know me as a public health guy. This is concerning. This is concerning, right, when a person of this magnitude is in that position, including Medicare, Medicaid, the CDC, FDA, and NIH. So you kind of understand how the person who's in charge of the FDA, CDC, NIH, Medicare, and Medicaid, right, has a very important position when it comes to healthcare. This position is also critical in coordinating responses to public health emergencies like pandemics, managing policies that affect families, children, seniors through programs like Head Start and the Older Americans Act. So again, if we don't, we hear these terms, right? And I think especially in healthcare, a lot of times we do a bad job of just throwing these big terms at everyone and assuming everyone's kind of understanding it, right? But again, if I tell you this position is in charge of Medicare, in charge of Medicaid, in charge of the FDA, in charge of pandemic responses, in charge of health response, right? In charge of the older, if I start saying these things here, CDC, if I start saying these things, you start understanding okay, yep, this is an important position. So now that we've established that this is an important position, let's talk about Robert F. Kennedy Jr., why I kind of have an issue with it, right? So a big issue of mine, right, with Robert F. Kennedy Jr., you may, especially if you've been following the Lunch and Learn community for a while, you know that he is a part of the disinformation dozen. What is that? During the pandemic, the height of the pandemic, there was singled out 12 individuals to say, hey, you know what? They're responsible for like 75% of the misinformation that is out here. 12 individuals responsible for about 75% of the misinformation that was out. And we know that misinformation leads to disinformation, leads to deaths. We could probably stop right there. Misinformation leads to disinformation, leads to deaths. This man was a part of the dozen who was responsible for the majority of misinformation here in this country that directly led to deaths. There are people here today who can't watch this State of the Union because they heard misinformation or they got fed disinformation by people of the likes of Robert F. Kennedy Jr. Big proponent of anti-vax campaigns. He wants to take fluoride out of the water, which, again, if you just do a search study on the benefits of fluoride in our water, right, like you would see how wild that sounds, right, that he wants to do that, right? Big proponent of it. Right? And a lot of the claim to fame that RFK has gotten has been his push on the types of foods that we eat or the things that they put in our foods. And I've got plenty. I have a whole episode where I talk about 10 foods that are banned here in this country that are not banned in other countries, right? Like to the point where it's like, all right, you can't eat that type of food here, right? Because like if I actually misspoke, 10 foods that you can eat in this country that you cannot eat elsewhere, right? Like, so I understand why people may be interested in hearing from a person who's like, you know what? Some of the stuff we're putting in our foods could be hurting us, because it's a possibility. It is a possibility, because clearly if other countries are saying, I'm not going to use that food if you put that thing in there, and we're doing it, some questions need to be had. So I'm not disputing that. But when I say this person is responsible for the CDC pandemic responses, this person is responsible for Medicare, Medicaid, this person is responsible for older, younger, like you kind of start understanding why, you know what? I probably don't want a person who peddles in misinformation and disinformation to kind of be in this position. You kind of, I hope you get that, right? I hope you can get to the fact that a person who has already been shown to be distrustful, to lie, and really to just base his foundation on evidence that is like faulty, right? Like, or just not true to say the least. This is not a person that I want responsible for the CDC, the FDA, the organizations that are supposed to let me know, hey, when can I not eat that Chipotle salad because there's E. coli in it? Hey, Boar's Head, like you have listeria. We are shutting that. Like remember, those are the agencies that are responsible for that. And now we put in charge a person who is responsible for spreading and feeding misinformation, disinformation, right? He's, like I said, I've already talked about him being such a big anti-vax component. In fact, like I think in a few weeks, depending on when you're listening to this, in a few weeks, I got a whole episode specifically on this guy right here, because like that's how bad he is. So again, very concerning as an internist, as a health content creator specialist, right, where you have someone who can kind of lead us, by us, my patients here in this country, down the wrong path. So I already expect that, especially if he's officially chosen to be the Secretary of Health and Human Services, that I'm probably going to be very busy having to combat a lot of the misinformation and disinformation that he peddles. I'm almost sure of it, right? I'm hoping that I'm not, right? For those, especially if you've been following me during the pandemic and post-pandemic, I've had a pretty chill life, so to speak, on the health content scene, right? Because we had an administration that didn't peddle in lies, that didn't peddle misinformation, disinformation. So there was very few things I had to combat. I think I'm going to get very busy over these next couple of years, you know, as long as he's in that position, just because of historically, like how busy this people, you know, RFKs and the liars have made us, right? So very concerning as an internist, as, you know, a public health professional, like having someone in charge of the departments that are supposed to be in charge of giving us good information. But again, that's why you're here. That's why you listen or watch, because you know what? You're like, hey, you know what? There's a lot of noise out there. There's a lot of people speaking over me out there. And I want someone who can speak to me, right? And not talk at me, right? So that's the name of the game, right? So that's RFK, right? Like hope Hope that wasn't too much for you, all right? Again, because we got a couple more that we got to talk about. Okay, so we are going to be talking about Dr. Oz, Mehmet Oz, who for most people know him. He was on that. He's on a TV show. He peddles a lot of things that that's factually not true, right? But he is a physician, right? So you may be thinking, all right, Dr. Barry Pierre, why are you kind of upset that Dr. Oz would be in charge of Medicare and Medicaid? And I'm going to talk about it, right? So first, let's set up the foundation. Let's set this foundation straight. What does that position do, right? So shout out to Perplexity. The Administrator of Centers for Medicare and Medicaid Services is responsible for overseeing some of the largest healthcare plans here in the United States, including Medicare, Medicaid, Children's Health Insurance Program, CHIP. The CMS Administrator ensures that these programs provide quality care, manages a budget of $1 trillion, and leads initiatives to improve patient outcomes, reducing costs. This role directly impacts millions of Americans who rely on these programs for their healthcare needs. So this is a position that is in charge of Medicare, Medicaid, and CHIP. That's essentially everyone, right? And I want to say everyone because I think a lot of times, especially for those who are on commercial insurance, you may be saying, hey, I'm not on Medicare, I'm not on Medicaid, I'm all right, my kids aren't on CHIP, I'm on Blue Cross, I'm on Humana, I'm on United. But for what a lot of people don't recognize is that those commercial insurances take their marching orders from Medicare. So Medicare is the big papa, right? Medicare is the big papa, right? And what Medicare goes, the other insurance companies follow and do. More importantly, especially for my doctors out here, right? When Medicare says, hey, I'm going to pay $100 for this procedure, the other insurance companies say, hey, if Medicare is paying $100, I will pay a percentage above or below based on Medicare. So Medicare is the standard foundation. So for people who may be on commercial insurance, I don't want you to think that just because this person is in charge of Medicare, Medicaid, and CHIP, that it does not affect your commercial insurance. It will undoubtedly affect you guys' insurance, especially for those who are commercial. So why, right, is there some concern with Dr. Oz, right? So let's give Dr. Oz his credit. Dr. Oz is a cardiothoracic surgeon, well-trained surgeon, well-educated in his field of surgery. He's not educated in the field of being administrator of an organization this large, of being able to manage $1 trillion. He's not. It just is. I'm not, right? And I'm an accomplished internist, but I probably shouldn't be in charge of $1 trillion budget when I don't have the experience, right? So that's already my first knock. A big issue I have with Dr. Oz, right, is, and I kind of foreshadowed it in the beginning. He's another one, right? He's not as bad as RFK, but he's another one who has been on the wrong side of science for the benefit of commercial and financial gain. He is one that will push certain products and beans and tea and all these other things here for commercial gain, financial gain, right? Yeah, so I'm already looking at him kind of wild. During the pandemic, he was a big one who was pushing Plaquenil being this wonder drug, even though study after study after study showed it was not. So he's another one, right, who, dabbled in the misinformation, dabbled in it, right, but has also, been one to be a proponent of, pushing things that are just not in scientific lieu of evidence to show that it has some benefit, right, for the benefit of financial gain, right? So that's a concern. He's also a proponent of privatizing Medicare, right? And I think that's something that you might hear. We might hear someone wants to privatize Medicare. What does it mean, privatizing Medicare? Because there's always this concern that, the Medicare dollars are going to run out. When I get older and there's not going to be Medicare around, there's always that concern of the cost of Medicare, right? Again, it's always weird, especially in this country, right? I'll go on my soapbox a little bit. In this country, I've never heard someone who is in charge of the Department of Defense say, man, you know what? This budget for the military might run out one day, right? That is never, ever brought up in any type of discussion. But for some reason, when we start talking healthcare, there's always this ceiling that people are worried about or concerned about. There's always this ceiling that should be heeded. But again, no one ever says, hey, you know what? I'm not sure if we're going to be able to pay our military guys. I'm not sure if we're going to be able to buy those billion-dollar planes. That conversation never ever happens. I'm not sure if in 20 years we won't have enough money to fund our military. That's a conversation that never happens. But in the healthcare side, right, and this is why I say when I talk about politics being like directly involved when it comes to healthcare, like this is always a concern of mine. It's always a beef of mine, always a gripe of mine, that it's always seemed as if the two things that there's always this ceiling we have to worry about in terms of cost is education and healthcare. Like for some reason, those two things are always on some type of chopping block to be concerned. No chopping block for my military folks, right? Again, and don't come after me. I got plenty of family in the military. So save your breath, right? Save your breath, save your comments. Don't waste your time, right? This is not it, right? But again, fast forward. We're talking about Dr. Oz, who again has like concerns that he wants to privatize Medicare, which we know will reduce access to people who like are eligible or who are on Medicare. And once you start reducing access, once you start playing around with the foundation, guess what happens, my commercial insurance folks, my Blue Cross, my Aetnas, my Humanas, my United, like guess what happens, right? Like those things will also fail, right? Like numbers will also go down. Revenue will also go down. All of a sudden, what the doctor gets paid $100 to do a procedure will become $70 and $50. Like that is a trickle down effect that will occur if we allow this aspect of privatization, right? Again, it's always been talked about, but now you have people who are in position, right, who have no problem, like especially because they're financially secure, they got no problem messing with things that affects millions of people. Again, remember this line, right? This rule directly impacts millions of Americans who rely on these programs for their healthcare needs. So again, this is not, right? This is not one position that I would like shoo, like, oh, we don't got to worry. Dr. Oz is there. He's a doctor. He should be okay. Now, there's some concerns there as well, too, right? So again, and this is the thing, right? Again, shout out to perplexity. Privatization results in denied claims, higher out-of-pocket costs for patients, which will eventually roll into deaths, right? Remember my path. Information, disinformation, deaths. Of Medicare, Medicaid, and all these other things here, right? In fact, they just want to kind of get rid of Medicaid, but that's a whole different discussion. Privatization of Medicare, you'll have, again, more denied claims, right? So more procedures that you want to get, like your colonoscopy, right? Your mammogram, all of a sudden, more of those claims are getting denied. More out-of-pocket costs for you, right? The consumer, right? So now it's costing you more to go see your doctor, to have that procedure, to get that lab test, which means you put it off longer and longer and longer. And we know in health, the longer you put something off, the worse it is when it finally runs into you, right? So like the path may not be straight, but the horizon is there, right? So definitely a concern for Dr. Oz in this position here. So this is definitely someone that we are also going to be keeping an eye out on. Like when we start thinking about like, okay, why are my claims like, being denied? Why is it that I'm in a donut hole earlier? Why is it that I have to spend more on healthcare? Like we're going to be able to point to positions like this and the changes that they likely plan on making because of it. All right, last but not least, let's talk about Linda McMahon, right? You may know her as the wife of Vince McMahon, who was like the CEO of WF or E. I'm not sure what it is now. And he's got a wild past in himself, right? But right now we're gonna focus on Linda McMahon. She has been chosen to be Secretary of Education. You may be saying, Dr. Pierre, why does the Secretary of Education? What would that have an effect? Me and my healthcare, my health plan, or my relationship with my doctor? Like I'm gonna talk to you, right? So let's set the foundation of what the Secretary of Education does, right? And then we'll lead into my problems with Linda McMahon. As you know, as you've probably gotten the gist, I got a problem with all three choices we talked about today. And then we'll kind of go from there, right? So Secretary of Education, responsible for shaping the nation's education policies, managing federal funding for schools, insurance compliance with civil rights laws and education. right? I think we can stop. I mean, that should be enough, right? Like, this is a big deal. This is a huge position across this country, right? Like, look at all the stuff they're responsible for. This role influences everything from the curriculum standards to programs that promote health literacy, career readiness, including the pipeline to future healthcare professionals. So now, again, so hopefully we've gotten the gist already. If you're in healthcare, or you're a part of healthcare because you're getting taken care of your needs, right? And now there's a problem in the pipeline to get more doctors like myself, right? Or more scientists, right, who make and help, create the medications and create the, you can kind of see how we're already running into a problem, right? If the person involved is kind of faulty, right? So let's talk about it. Linda McMahon, right? Again, she was part of the head of Small Business Administration. She has no experience in education, right? So why is she going to be the Secretary of Education? One, because, the president chose her, right? And two, you'll hear this word again, privatization. She is another person, just like Dr. Oz, who's okay with privatization. And privatization may seem like this big buzzword, right? But the way I want my Lunch and Learn community members to kind of digest it, think about, hey, you know what? Those who have, right? Those who have can afford, right? More expensive things, right? So they can afford education to be more expensive. They can afford, healthcare to be more expensive, right? So it doesn't bother them, right? That doesn't factor us at all. It's those who are not higher up, who are not full of haves, right? Who can't afford healthcare costs to be higher, who can't afford healthcare premiums to be higher, who can't afford their education and the curriculums and the resources, right, to be higher. They literally cannot afford it. So here we have another person in a position where the general public, right, for the greater good says, hey, you know what? We should do less privatization. We should make it more readily available for everyone. But you have a person saying, no, I only want it available for the smaller folks, right? So again, this is Linda McMahon. And this is how she's big on school choice, diverting funding from public schools to private institutions. Which communities do you think that are going to be hurt more when I start pulling funds from the public side and giving it to the private side? Yes, the underserved communities, right? And again, as a physician, right? I understand I'm in a privileged position because I'm a doctor. I understand that. But I also understand that the majority of patients I take care of, don't have that luxury, right? Being a doctor, right? Or, from a financial gain perspective, they don't have that luxury. And they go to schools where, they need all the resources they can get. They go to schools where the teachers are there and the teachers have to keep sending out notes and say, hey, can you send this? Can you send that? Just for the rest of the class, right? They go to schools where that's more norm than everything else. And here you have someone who's in favor of taking money from those schools, right? And now they want to be in charge of the whole Department of Education, which again, obviously focuses on curriculum, right? They want to take those money from those schools and send it elsewhere to the private schools, right? They want to send the money from the public institutions and send it to the institutions that already have. If you're a private institution, you already have it. Why do you need more? Because the public school is getting it and I'm not getting it. So I want their money. Give me their money. I don't care about their test scores, right? And then, right, I take resources from them and then I blame them for their lack of resources. I take resources from them, then blame them for the lack of resources. Blame them for their lower test scores. Blame them for all of the inefficiencies that they suffer because they're in a place that is resource deficient. And it's resource deficient not because it just disappeared. It's resource deficient because I took the resources and I put it in a place that was already resource surplused out. Right? This is what's so frustrating about these positions here, right? And there's many more on his cabinet, but these three I wanted to make sure I highlight because when you're a physician, practicing physician, and then obviously you do what I do for a living, right, where I just I educate online, it could be frustrating because I know for a fact a lot of my community may not even understand how significant that person being in that position is, right? And that's my job. My job is to help bridge that gap of information so that you understand, like, oh, like this is a big deal, right? So let me see. She's got some other issues, right? She has a lack of emphasis on diversity, equity, and inclusion. So you already know that's going to be an issue, right? You already know that's going to be an issue, especially when it comes to healthcare, especially when it comes to our pipeline of education. They already want to arrange and change curriculums to only fit a certain story that's being told. They want to take stories out. They don't want stories being told because it may make someone feel bad, right? Regardless of the fact that taking out that story like won't uplift another group, again, neither here or there. But again, as you're having these efforts, right, and we talk about cultural competency a lot on this channel, right? I can relate to patients who are Black. I can relate to patients who are male. That is a cultural competent component of it, right? If you have less people who look like me, right, or less people who are of a certain culture in a field, guess what? The population who still needs to be taken care of, they're not going to feel as connected, right? I always draw a conclusion when I the correlation when I talk about COVID. And a lot of my education during COVID, especially for my Black patients and then just the Black, followers that I have in this country, was that the distrust that the medical system has always had for the African American community almost gets swept under the rug, like they want to do in education, right? Right, where they don't want to tell the story, right? So in the medical field, they almost want to sweep under the rug all of the atrocities. So anytime you bring it up, they start saying, oh, come on, Tuskegee, that was so long ago. Henrietta Lacks, oh, come on, like, look at all the advances. They always want to sweep it under the rug, and they're upset when that same community says, you know what, that vaccine, unless someone like Dr. Pierre is educating me on why I should take it, I just think that's another Tuskegee. They don't even understand the correlation behind it because they keep refusing to tell the stories. So you have a person in the Department of Education who wants to continue not telling the stories, not educating the entire American public on, hey, you know what? This country didn't do right by a lot of people, right? Especially Black folks, right? But it definitely did not do right by a lot of people. And this is our education to make sure we don't make that same mistake again. But here we are, right? We got these three juggernauts here, right, that are in potential positions that will have a impact on our healthcare. Will, not even a if, will have an impact on our healthcare. And I want to stress, this State of the Union to make sure we do not, one, downplay, right, like their positions, right? Because most likely they're going to get chosen, right? So we know that they're going to get chosen. So now it's on us, right, to continue to be educated on what we can do moving forward. So that's going to be that's my promise to you guys, especially over these next 4 years, is I'm going to make sure that when things are being said that are distruthful or changes are being made that can directly affect you, you'll see me, you'll hear from me, whether, because I know I got people YouTube, Facebook, Twitter, or X, Instagram, right? So wherever you're watching me from right now, I'm going to make sure that I keep the most updated content available for you, right? Truthful content available for you, right? Because I understand that the road could lead to death if you are steered down the wrong path. So again, I'm yours truly, Dr. Barry Pierre. Thank you for, joining our first Lunch and Learn Community State of the Health Address. Hope you got a lot of good information today. Big thing for us is empowering yourself for better health. Now that you've been empowered with this knowledge, I always say, fact check me, right? So go in, like I said, this will be up. Go in, go back, read, do your research, ask questions. If you got questions, drop it in the comments as well, because I'll get to it. And I'll hopefully either in a comment reply or a whole video or a podcast episode, right? Because that's what we do here for the Lunch and Learn community and all of those adjacent Lunch and Learn community members who may not be in it, right? So again, if you want to hear more from me, right? Again, obviously go to drbarrypierre.com. Sign up for our newsletter. We send out a weekly newsletter where we kind of give updates on what's going on, what's happening, right? So sign up for that newsletter as well, and just stay tuned because we are likely to be very busy